Hi everyone, my name is Stephanie Villanueva, and the career that I'm interested in pursuing is an epidemiologist. Ever since I took an introductory course to epidemiology, I was very interested in the career and everything it had to offer. So, a quick introduction of what epidemiologists do. When I first entered my public health degree, I had no idea what epidemiologists do. But it is a vast field and it is a great job if you have passion for health and research. So, epidemiologists surveillance disease and determine how to control and stop the spread of disease within a population. They also investigate thousands of diseases that can range from autoimmune diseases to chronic diseases. So, not only do they focus on, for example, right now in the COVID-19 pandemic, they're focusing on that, but they do also focus on chronic diseases and how it's affecting the population. And that way, when they can pinpoint why this population is getting more of this disease or that disease, they're able to help control and stop the spread of it. So, moving on to some of the educational requirements to becoming an epidemiologist. Typically, you'd need a master's degree in public health. Unfortunately, your regular bachelor's degree in public health is not enough because you would need more classes in epidemiology. Sometimes they do require a doctoral degree in some cases. Education is really important when becoming an epidemiologist since there are many skills that you must develop. For example, designing programs and analyzing and reading data. Education really is key when becoming an epidemiologist since most of them work in offices, laboratories, health departments, and sometimes in universities. There is a need to further your education to ensure that you can do all your duties. So, moving on to the expected work outcomes and duties of an epidemiologist. They investigate thousands of diseases. Like I mentioned, they don't focus on just one disease. They also focus on chronic diseases in the population. They also give intel on how to control and stop the spread of diseases. For example, as we could see in the COVID-19 pandemic, they gave us intel on to stay home. We all quarantined for that. They also monitor and manage public health programs. They collect and analyze data. They perform surveys and they work with other health professionals. They also perform their research and tests, and sometimes they work from the state and also a federal level of the government as well. So continuing on with the expected work outcomes and duties, a lot of the websites that we're familiar with, like the CDC, all of those information is run by epidemiologists, and most of that data comes from epidemiologists. But although epidemiologists study the causes and sources of disease, they are not doctors, so they do not perform any physical examinations, they don't diagnose any diseases, and they do not prescribe any medications. But they do consult with doctors to make sure that they're providing the right information on the diseases that they are giving intel about. They also work to understand disease and its patterns mainly. So there can be many potential challenges being an epidemiologist. There are research-related challenges that come with other fields. So there's a challenge to collaborate with other experts in different fields. There could be a challenge for each field to understand their vocabulary and their literature. There can also be some legal challenges when becoming an epidemiologist when it comes to handling data and data that cannot be accessed. This leads to another challenge as well, which is ethics. Epidemiologists do a lot of research, so there can be a lot of issues with privacy when handling data and sharing and conducting research. Another challenge is that there's a lot of criticism when it comes to epidemiology. As we can see in the COVID-19 pandemic, a lot of people didn't take it as seriously, or they didn't really believe that they needed to quarantine, and people's beliefs can create a lot of criticism on epidemiologists' theory, and they need to make sure that that doesn't doubt the scientific contribution. So moving on to the rewards of being an epidemiologist, and although there are a lot of challenges when becoming an epidemiologist, I think that the rewards really outweigh the challenges. So not only are you protecting individuals, you're protecting the community from diseases, and epidemiologists also save lives at a community level. And as we know in public health, we strive to help people at a community level. So you also have the power to reduce suffering within the community as well. Epidemiologist's salary can be up to $74,000 per year, so that makes it a rewarding career path as it is. There are also a lot of benefits like medical insurance, paid vacations, and holidays, and there are also retirement plans as well. So in conclusion, do I still want to pursue this career? Yes, ever since I've done research on this career, I've been really interested in pursuing this position. This research actually made me more interested in becoming an epidemiologist, more than I have before. I was planning on pursuing my master's after I graduated, but I still wanted to get a little bit more experience and then come back and apply for my master's in public health. I wasn't really sure what to focus on, but I always thought as epidemiology being one of the number one choices I have. I know there could be a lot of challenges with this job, especially after we have seen in the COVID-19 pandemic, but it also made me realize that there is such a need for them when there's times like this. If anything, I see epidemiologists as heroes during this time, and their hard work really pays off in the end. Although I think that's going to be a longer road to actually being an epidemiologist, I think that it will be really worth it in the end. So thank you for listening, and if you have any questions or comments or anything you want to discuss, please let me know. Thank you.